right, so I'm going to demonstrate how to halter, lead, and tie a horse. So I'm going to go ahead. Hey, my pretty girl. I'm just going to let her know that I'm here. Come here, Starla. She said I'm just going to eat right now. Come on, pretty girl. All right, so I'm going to slide this over her snout. This is going to go behind her ears. I'm going to grab her buckle and get that attached. There we go. And I'm going to go ahead and lead her. I'm going to make sure I pick up all the slack from the ground, and I'm going to make sure that I do not wrap it around my hand. I'm going to go ahead and grab it right below the buckle. I'm going to go ahead and lead her around, staying at her left side. Right. And then we're going to come on over here, and we're going to tie her up beside the fence. Is she okay to go right? Hold on. She wants the food. Are we okay to go beside the cow? Mm-hmm. Okay. All right, pretty girl. Over here. Good girl. Okay. All right, so I'm gonna go ahead. I want to make sure she's got enough room to move her head around. Go ahead and pull this. We're gonna do a, hold on, pretty girl, a quick release. All right, we're gonna push that nice and tight. That way, if she pulls, it's not coming undone. However, if I need to quickly release her, I can pull on here, and then as she shimmies, the rest of that will come out. So that's how you halter, lead, and tie a horse. All right. Okay, so now I'm gonna demonstrate how to apply a twitch to a horse. So I'm gonna go ahead, hey pretty girl. I'm gonna go ahead and grab her lip. I'm gonna go ahead and pull the twitch through, and we're gonna twist it up. And that is how you apply a twitch on a horse. All right, we can release it. All right, so now I'm going to demonstrate how to place a tail wrap. So the first thing I'm going to do is I'm going to go ahead and tie a knot at the end of her tailbone. So I'm going to go ahead and ends about right there. All right. Go ahead and get this all wrapped up. Hey, pretty girl. I know. You okay? She's kind of limping.
Yeah, she's just resting her leg.
Okay. Not the prettiest knot. Okay. All right. So now I'm going to go ahead and start wrapping. I've got some vet wrap. You just have to be really careful with it. So you want to make sure you don't get too tight. Let's see. Hey, pretty girl, you ready? I'm going to go ahead and start at the base of that tail. Hey, pretty girl. Alright. I'm going to try and get it as smooth as you can with as few wrinkles as possible. And you're going about half the width of your vet wrap as you go down. Okay, so I'm going to go ahead and fold up our little knot right there and continue wrapping. Good girl. And I'm making sure I keep my body to the side of her. And I'm just keeping a little bit of distance just because I am pregnant. Making sure we all stay safe. All right, and so that is how you place your equine tail wrap. You want to make sure that you continue to monitor the tail. Monitor the tail to make sure that it's not swelling. You want to make sure that it's not losing, that it's not becoming cold, cold to the touch. And that's how you place your equine tail wrap. All right, so I'm going to demonstrate how to apply an equine leg wrap. So I'm going to start with my quilted wrap. I'm going to go ahead and start it at the medial aspect of her leg. I'm going to wrap it around, keeping it as nice and flush as possible, as well as making sure you're not leaving it too loose. All right, so we've got that on there. I'm going to take my poly wrap. I'm going to start right in the middle. Let's see. Go ahead and wrap it around. I'm going to leave about an inch of the quilted wrap showing at the bottom. All right, and then you're going to go ahead and attach your Velcro. You're going to go ahead, once you're finished wrapping it, you're going to go ahead and stick 2 fingers at the top and the bottom to make sure it's not too loose and it's not going to slide off her leg, and to make sure it's not too tight to cut off circulation. So that's how you place your equine leg wrap. Okay, so now I'm going to demonstrate how to take a lateral x-ray of this horse's fetlock. So I'm going to go ahead and take my plate right here. Hey, pretty girl. I'm going to go ahead and place it. Got to stand up. Like that's nice and centered. I've got my marker on the cranial aspect right there. And so now I'm going to go ahead and take my x-ray unit. And I already have my KVP set to 66 and my MAS to 1. I'm going to go ahead and measure about 66 centimeters. There we go. Between my x-ray unit and the horse. So let me scoot back a little bit more. There we go. All right, so now everything is all set. I'm gonna go ahead and I'm gonna step back a little bit. I'm gonna go ahead and rev up my engine until it's ready. I'm gonna announce myself. I'm gonna take my shot. Shooting. Okay, so next we're gonna go ahead and do our AP view. So I'm gonna go ahead and set this back. Hey, pretty girl, I'm over here, okay? Hi. Go ahead and take this. Let's see. Make sure I have that the right way. Maybe like this. I think I have it backwards.
Yes.
Yeah, there we go.
Up and down, and then yep, and then the marker will be on the outside.
Perfect. I thought so. Okay. There we go. Whoop. Hey, pretty girl. Hi, I'm over here, okay? All right, so I'm gonna go ahead and place this right here for her AP view. Get it right. Oh, it's okay, baby. Let me come see what that looks like. Let's get over here. I think that'll be sufficient. So I'm gonna go ahead and take my unit. Well, she said I'm gonna move. Let's make sure. Go. Just nicked it just a little bit. All right, I'm gonna go ahead and take my unit, bring it in front of her, and again, I'm gonna measure the 66 units. I still have it set from where it was. Hi, pretty girl. Okay. Go ahead and grab. Let's see. All right, perfect. So now I'm going to go ahead, leave her right where she is. I'm going to take my button, I'm going to step back about 6 feet as best I can. I'm going to prep my engine. Oh, she didn't move that leg yet. All right, and announce myself. Shooting. And there we go. So now I'm going to go ahead and demonstrate how to administer medication via oral dosing syringe. This is just applesauce here for Starla. Hey, pretty girl. So before I go ahead and just shove a syringe in her mouth, I'm just going to go ahead and kind of part her lips to let her know that I'm here so I don't startle her. And I'm going to go ahead and stick my syringe. Hold on, baby. Hey, I want to make sure she's got nothing in her mouth. Go ahead and put it back in the corner and administer a little bit at a time. There we go. I know, Mama. Good girl. All right, and make sure she gets all of that down. And that's how you use an oral dosing syringe. Okay, so I'm going to demonstrate how to perform jugular venipuncture on a horse. So I'm going to go ahead and occlude my vein, just so I can find it. There we go. I'm going to go ahead and sterilize my area with a little bit of alcohol gauze that I have here. And you're just going to wipe it. Oh, is it chilly? Until it comes clean. Hi, pretty girl. Let's do another one. Okay, that's pretty clean. So I'm going to go ahead and occlude my vein. Take off my cap. Go ahead and insert. It's okay, Mama. Insert my needle. Pull back. I'm going to go ahead and hold off for about 30 seconds so that we don't get a hematoma. And that's how you pull blood on a jugular vein. Okay, so now I'm going to demonstrate how to give, hey pretty girl, an IM injection on a horse. So over here, up here we have our nuchal ligament, followed by our vertebrae, and then here is our scapula. There's the cranial aspect of it. You're going to go right in that triangle right there. And so I'm going to go ahead and clean my area with some alcohol gauze, just until it wipes clean. Go. Hey pretty girl, you're doing great. One more, and then I think we'll be okay. All right, so now I'm going to go ahead and take my injection. This is just saline. She does not need any injections right now. And I'm going to go ahead and just insert straight in. And I'm going to pull back to make sure I don't get any blood in my syringe. And I'm going to inject. And so that is how you give an intramuscular injection on a horse. Okay, so now I'm going to demonstrate how to give an intravenous injection on a horse. So I'm going to go ahead and clean my area with some gauze. And that's pretty clean. I'll do it one more time. Hey, pretty girl. All right, perfect. And she's not on any medications right now, so I'm just giving her some sterile saline. I'm gonna go ahead and occlude her vein. Pretty girl. It's okay, Mama. Just make sure I feel it. Okay, there it is. Okay, so now I'm going to go ahead and insert my needle with my bevel up. Pull back on my syringe to make sure I do get blood. Release. And inject my saline. Okay, so I'm going to demonstrate how to do a heart and lung auscultation. So first thing I'm going to do is I'm going to go ahead and listen to Starla's heart. So that's going to be right over here by her axilla. Hi, pretty girl. All right. I'm going to listen for 15 seconds and multiply by 4. Okay, so that's going to be about 40 beats per minute. And then I'm going to go ahead and listen to her lungs. Let's start, let's see. Couldn't hear any wheezing or crackling, no starters or striders, at least on this side. And I'm going to go ahead and listen to the other side in just a second, but I'm going to count her breaths first. I'm just going to watch her abdomen rise and fall. Nice slow breaths. I'm going to say that's probably about 11 breaths per minute. She's taking nice slow breaths for us there. I'm just going to head to the other side real quick and listen to our right side as well. Hi, pretty girl. Hi, I'm over here, okay? Hi. I'll give you a listen over here. Just going to start. deep breath for me, Crystal. Okay. So I don't really hear much going on in there, so I think she's got some pretty healthy lungs. So that's our heart and our lung auscultation, and now I'm going to go ahead and take her rectal temperature. Let's see, I'll probably come from that angle. Alright, hey pretty girl. Alright, so I'm going to go ahead, we've got her tail wrapped, I'm going to go ahead and stand to her side and just lift up her tail. See if I can see it. Insert the thermometer. Go ahead and turn on my thermometer. Good girl. I don't think it was far enough in. It didn't read well, so I'm going to do it one more time. All right, 100.1, that is a perfect temperature for a horse. So that is your TPR on a horse. I'm going to demonstrate how to collect a milk sample and conduct a California mastitis test on this cow. First thing I'm going to do is I'm going to go ahead and clean all 4 quarters. I'm going to clean her teeth. I'm going to go ahead and clean them with the alcohol gauze. All the way down to the tips. Alright, now that we got those clean, I'm going to go ahead and express some milk. So I'm going to make sure I hold my palate relative to her body, so I'm going to make sure I have my handle towards her tail. I'm going to go ahead and come in and express my sample. I'm going to actually discard. I'm going to discard the 4 milk. And then I'll go ahead, I'll do that for all of them real quick. We don't want 4 milk in our sample. One more. It's okay, baby. One more. Okay, ready? Okay, now I'm going to go ahead and collect my samples. I just need enough to cover the bottom ring.
Now these are getting good, kids. She's good, kick. She's getting antsy, that's all.
Okay. Come on, Mama, you're doing great. And then we're going to try and level it out, so we're going to kind of turn it until they all pour out to the even length. It looks like they're all pretty even. So now I'm going to go ahead and add my reagent. Oh, keep it sideways.
Second line.
Oh, I'm sorry?
You level out to the first line.
Oh, okay.
And then second line.
Gotcha, okay. So I'm going to add this in. Alright, I'm going to swirl it around for about 10 seconds. You want to make sure you read it relatively quickly. Your results can go away within 20 to 30 seconds. And it looks like right here, our C, which is her front right teat, might have a little bit of mastitis in there. It's a little bit thicker than the rest. And so that's how you perform a California mastitis test. Okay. All right, so I'm going to demonstrate how to use a cattle chute. So we'll start at the back right here. This right here is kind of like the little gate, the little door that's going to kind of keep the cows in the chute. It's also good to have in case you're working on their feet, like if they have some sort of abscess. It'll also kind of block you a little bit if they try to kick. And so you would go ahead and shut that, and then you would twist it lock right here. And then you send your cow around and into your chute. And they're going to come in and they're going to put their head right in here, and their shoulders are going to lock it in place so they can't go anywhere. If they went too far forward a little bit, you need them to back up. You can pull on these, make it come back a little bit if you need to. Or if you're ready to release the cow and let them go, you can pull on these ones in the front. Back right, there we go. And that's going to push them out, and they'll use their shoulders to go ahead and head forward. And so that is the basics of using this cattle chute. Should I stay right here? Okay, so he is working the cattle chute to get this cow in there. Come on, Mama. Hi, pretty girl. There you go, Mama. There we go. All right.
Most bombs, head shoots ain't this prehistoric.
That's okay. All right, so there is our cow in our chute. Right. All right, so now I'm going to demonstrate how to put a halter on a cow. So I'm going to go ahead and slide. Hi, Mama, it's okay. I'm going to slide this over her ears. It's okay. I'm going to go ahead and pull this down over her snout. It's okay.
Okay.
Here we go. Make sure we have that even so it's not in her eyes. We're going to go ahead and tighten it a little bit. All right, and that's how you place a halter on a cow. Now I'm going to go ahead and perform a tail restraint. So I'm going to go ahead and grab the tail right here, Mama, at the base. I'm just going to go ahead and flip it up. Let's see. They're pretty strong. And that's just going to, you don't want to hurt them. It's just to kind of restrain them, to kind of make them freeze so that they're not going to go anywhere. But again, you don't want to use too much pressure because you do not want to hurt or break that vertebrae in that tail. So that's a tail restraint on a cow. All right. All right, so I'm going to demonstrate how to give Pepto via oral dosing syringe. Hey, buddy. So I'm going to go ahead, I'm going to lift his head up. I'm going to go ahead and put it in the corner of his mouth. Hey, buddy, open up. I know. I know, buddy. There we go. We're going to go ahead and administer it in that back corner. A little at a time to make sure that he swallows it all. It's okay, buddy. There we go. See, it's good. Good job. You're okay. We're almost done. All right. There we go. And that's how you administer medication via oral dosing syringe. Okay, so I'm going to demonstrate how to use a balling gun today. Hi, pretty girl. It's okay. Hey, it's all right. So I'm going to go ahead. I'm going to lift up her lip. I'm going to go ahead and put that balling gun in there to open up her mouth. Go ahead. It's okay. You're okay. Hey, pretty girl. I know. We are almost done. This is the last thing, okay? There we go. So I'm going to go ahead and shoot it, administer our medication, and that is how you use a bowling gun.
You got that time.
Okay, so now I'm going to go ahead and get the pulse and respiration on this cow. So I'm going to go ahead and listen for the heart first. I'm going to listen right behind the elbow right over here. Hey, pretty girl. I'm going to listen for 15 seconds and multiply by 4 to get our heart rate. So we can find that. So that's about, heart rate's about 50 beats per minute. So now I'm going to go ahead and listen to her lungs. Let's see, let's start with you. So lungs on the left side sound pretty clear. I don't hear any wheezing or crackling, and I got a respiratory rate of about 28. Now I'm gonna go listen on the right side. You wanna make sure you always listen on both sides just to make sure you're not missing anything. I'm over here now, Mama. All right, let's see. Okay, and that side sounds clear as well, so I would say this is a pretty healthy horse, or a pretty healthy cow. All right, so I'm gonna go ahead and take a temperature on this cow. We're gonna take it rectally. I'm just gonna lift up the tail, insert my thermometer. Good girl. (101.2), perfect temperature for a cow. Okay, I'm going to demonstrate how to perform a jugular venipuncture on a goat. So I'm going to go ahead and sterilize the area with some alcohol gauze until it comes clean. And I'm occluding here at the thoracic inlet to try and make that jugular vein pop. There we go. All right. There we go. So there is our jugular venipuncture on a goat. Okay, so I'm going to demonstrate how to perform a sub-Q injection on a goat. So the first thing you're going to do is you're going to take your alcohol gauze and you're going to clean your area. We're going to go over here in this axillary region, right by the flank, and you're just going to make sure you clean it thoroughly until your gauze comes back clean. All right, and so what you're going to do, hey buddy, you're going to go ahead and pinch the skin and make a little tent. You're going to insert your needle. You're going to pull back to make sure you don't get any blood in your hub, and then you're going to insert your medication. That's how you perform a sub-Q injection on a goat. I'm going to go ahead and clean our cephalic vein just to make sure that our hair comes out clean, which it is. I've got my needle bevel up while Jamie's cleaning the vein. Go ahead. Insert that into the vein. I'm so sorry, friend. Oh, there we go. All right, so I got a flash. I'm going to go ahead and insert. You can let it go ahead and administer my drug intravenously. Okay, so now I'm going to go ahead and clean up the housing conditions for these cows and horses. So I have my pitchfork right here. I'm going to go ahead and just scoop as much of the stool sample as I can. Get that in our wheelbarrow. Alright, so now we're going to go ahead, we're going to add this to our compost pile. There we go. Turn around. Hey, Luke. Alright, I'm just going to put this into the pile for composting. Oh. Perfect. Now we're going to go ahead and head over to the little shed right here and just see if there's anything we can scrape over there real quick. Alright. Alright, so this is just their little shed where they can come for some shelter to hang out of the sun for a little while. So we're just going to kind of move the bedding and the flooring around, make sure that there's no big piles of stool sample that we need to clean out. It's okay, buddy. There's a little bit right there. And then if you need to, you can always replenish with fresh hay. But just make sure that everything's nice and clean and comfortable for that. Get that out of there. Try and shake out as much as you can as to not waste all of your bedding and your flooring. Alright. And then you also just want to check in, just try to get down any cobwebs that might be in the corner of your stalls or your shelter. And you want to work from the top to the bottom, just so that you don't just recontaminate where you just cleaned. And so that's how you would clean a housing area for a horse or a cow.